Okay, so work me through this question here.
Which of the following complications is most likely to occur if this condition is left untreated? A 1-week-old male infant presents with a distended abdomen and poor urine output. Physical examination reveals a palpable bladder. An ultrasound shows bilateral hydroureteronephrosis. Avoiding cystourethrogram is performed and reveals a dilated posterior urethra with a tapering proximal to the membranous urethra. Which of the following complications is most likely to occur if this is left untreated? Okay. So what I'm seeing here is a 1-week-old male who is now having like bilateral hydronephrosis or hydroureteronephrosis,
Okay.
coming from it reveals a dilated posterior urethra with a tapering proximal to the membranous urethra. So proximal to the membranous urethra. So kind of at that area. Ooh, I guess I understand why I missed this one. Um,
Yeah, this is a difficult question for sure.
which of the following is left if untreated? So complications can be left untreated. Bladder rupture. I am thinking bladder rupture could be an option just because of the idea that like you have a building up of like pressure. So that
Okay.
could be an option. Chronic kidney disease. I don't know, maybe. Uh,
Okay.
nephrolithiasis. I don't. I always think renal agenesis with Potter's disease, and so I don't think this is Potter's disease. I'm going to say no
Okay.
to that. And vesicular reflux to me is another cause for hydroureteronephrosis. So I'm going to say probably not that.
Okay.
I'd end up probably going with bladder rupture, and I don't. That's probably my best guess.
Okay. Let's take a look at this. So this one's a kind of actually interesting of a question. Okay. Bladder rupture, I mean, it's very, very rare, I'd say. Okay. Very rare when you're dealing with kind of a so what is the diagnosis here, would you say?
Um, I actually don't know.
Yeah, so this is going to be kind of your members, your posterior
Posterior
urethral
urethral.
valve, right? So congenital obstruction of uropathy, right? And usually in males. And what can end up happening is if you kind of look at, if you, this is like, I always think of this kind of more of an anatomy question. Okay.
Mhm.
So you have your kidneys here. Okay. You have your ureters. Okay. And then you have your bladder and then your urethra. Okay. And
Yep.
then you have this like, posterior membrane that's kind of still flapping around in here that causes a little bit of obstruction here. And so you already know that urine backs up all the way from kind of the proximal portion of the urethra all the way back, right? And so if you think about that, right, you're gonna have a dilated bladder because you can't pee it out. Your ureters are going to be dilated here, right? And also, right, your kidneys will be dilated, right? Because that makes
Mhm.
sense. You have a distal obstruction, right? So now you have to ask yourself, okay, when you have this obstruction, right? I mean, urine will be able to leak. Okay, I'm just letting you know that. Okay, very rarely will the bladder actually rupture. Okay, but over time, as you get urine backing up over and over and over
Just
again,
toxic things are building up. Okay.
exactly. And also the pressure, right? What happens to the what is it? The renal calyces or the pelvises, right? Of the inside the kidneys, right? Those become dilated, right? And when those
Exactly.
become dilated, right, your nephrons are not going to work as well, right? And so over time, that's going to damage it and cause chronic kidney disease for sure. Okay. So let's talk about bladder rupture. Like I said, not as common. Okay. Um, nephrolithiasis, right? That's not really gonna happen because no stones, right? In a sense, right? Renal agenesis, like you said, Potter syndrome and vesicular ureter reflux, you're gonna have that, but really, that's not really a complication, if that makes sense, right?
Yeah, it's almost
That's
like a cause for
yeah,
this.
exactly. Bingo, right? So it's not really a complication, right? And so I would say, key takeaways, right? When you're looking at this, I always say the coolest things to make kidney issues like easier and also GI issues easier is to think about the anatomy. The anatomy will help take you home on these questions. And number two, right? I think you've got it down to two. Think about kind of I guess likelihood, right? Very rare. I know this is more of a clinical thing, but very rare that a bladder really ruptures from a buildup of urine. Usually, bladder rupture, you think of more like trauma, right? And
Exactly.
so you have to ask yourself, okay, so if you have a bunch of pressure in the kidney, what will that cause? And that's going to cause a lot of kidney damage. So,
Okay. That's good.